The question is how Chinese have integrated Western medicine and traditional Chinese medicine. These days, if you're going to med school in China, you get a traditional Western medical education. If you're interested in specializing, and everybody does when they take that path, whether it's going to be a general practitioner or oncology or OBGYN, then you can choose that path. But you can also choose a traditional Chinese medicine path and study at the hospitals and clinics that focus on that. Once you do that, then you have this other choice. Do you want to do acupuncture or herbal medicine? Or Tui Na, which is their medical massage. Once you do that, then you're either in Tui Na, you're either in acupuncture or herbal medicine. If you're in herbal medicine, then you specialize again. So some of the doctors that I studied with over there, they would spend in the herbal medicine section, and the hospital actually would fill the prescriptions, cook the herbs, which traditional Chinese medicine herbs are basically a bunch of sticks and roots and leaves and stuff cooked into a soup. And they actually would cook them and package them for the patients. But if you're going in there and you're going to go to a doctor, like for instance, the OBGYN doctors would sit there and they would have a room, if you split this room, they have a room this many patients, and they would sit there all morning and just write prescriptions of Chinese herbs, just roots and leaves and stuff, and put down the prescription based on old traditional formulas that they tweak per patient's symptoms, right? And I didn't have a chance to get into how that's done, but so then those doctors in the afternoon will go off and do surgery. So they'll do Chinese herbs in the morning or surgery in the afternoon. So they do incorporate it. A lot of the doctors, a lot of the hospitals are traditional Western medicine hospitals. The Chinese as patients will generally some of the kids will sort of shun the traditional ways. That's a bunch of old hooey, and all that. But some of them take it on and sometimes they use it, for instance, for an oncology. If the patient is too weak to have chemotherapy, they'll use Chinese herbal medicine, or maybe a mix of it. So you see sort of this conglomeration. But as Patrick was talking about the herbs as food, a lot of them use herbs as food in their regular cooking to cure things that so they don't have to go to the doctor. So there's a big knowledge base of that over there too. So.